Okay, thank you. So today, shifting our gears from KRAS mutation, now we will be discussing some of the important points about BRAF mutation. Basically, the methodology which is being used for investigating these BRAF mutation and how these results are being interpreted. So if you look, BRAF, needless to say, it is one of the most commonly mutated genes which are seen in different types of cancer. And basically, it codes RAF family, which helps in cell growth, survival, and differentiation. As far as mechanism, frequency of BRAF is concerned, the frequency of BRAF varies from as high as 50 to 60% in thyroid and melanomas, whereas in lung cancer, it is around 1 to 3%. And in lung cancer, BRAF mutation is commonly seen in never smokers, women, and with aggressive histological type. As far as therapy is concerned, there are certain BRAF inhibitors which are being under different clinical trials, and we will be listening to those in the coming subsequent talks. Now, if you see, BRAF is, as I said, it is the most widely mutated genes, and there are more than 200 different types of mutation which has been investigated in BRAF across different solid tumors. And these mutations could be either nonsense mutations or stop loss mutation or frame shift deletions or splice site variants. But what is interesting to note over here is that more than 90 to 95% of the mutation is falling under BRAF codon 600, and this is being investigated in most of the solid tumors. If you look at the testing strategy, there are different types of mutation testing strategy. Some of them may be used for immunohistochemistry, Sanger sequencing, pyrosequencing based assays, real-time based assays, and next generation sequencing. So how do these tests are being performed and what is the interpretation, we will just discuss in brief. So in case of ISC, ISC is being investigated for mainly for V600E. The clone which is being used for BRAF mutation is VE1, and it is being investigated across different solid tumors like melanomas, colon, and lung cancer. And as far as the interpretation goes, the score varies from 0 to 3 plus, wherein 2 to 3 plus is considered to be positive. And then whenever there is a clear cytoplasmic scan, we can call it as a positive for BRAF mutation, whereas staining of 0 and 1 plus is considered to be negative. So in ISC, it is very straightforward, but one limitation with ISC is that it can detect only the clone specific mutation, like it cannot detect anything else beyond B600E. Similarly, for molecular based assays, Sanger sequencing is the most widely used and gold standard in earlier days, but as the technology has evolved, we have moved from Sanger sequencing to real-time PCR to NGS. So in case of Sanger sequencing, there are two sets of primer which are being designed, which covers outer region of the V600E region. And then once the PCR amplification is done, the sequencing is done with a reverse primer, another set of primers. So as far as the interpretation goes for Sanger sequencing, you can see GTG is the codon for V600. And in case of wild type, you can see a single peak T. Whereas in case of mutant, you can see there is a combination of two peaks, which is T and A. So whenever there is a two peaks which is being seen in Sanger sequencing, you call it as a mutation. But again, the one limitation with Sanger sequencing is that the lowest LOD for Sanger sequencing is around 15 to 20% and requires a pretty high number of tumors, as high as 30 to 40% of the tumor in the sample. But again, advantage is that it can detect both V600E and non-V600E mutation as well. Now, another method which is also being used and mostly used for BRAF mutation is pyrosequencing. As far as the principle goes for pyrosequencing, it's a combination of 4 enzymes. Polymerase which basically helps in DNA extension. So whenever there is a binding of one nucleotide at the complement site, there will be release of one pyrophosphate. This pyrophosphate will be utilized by sulfurylase enzyme to convert pyrophosphate into an ATP molecule. And this ATP molecule will be utilized by luciferase to convert the base, which is called as 1-lite. So basically, how does the report is analyzed is that whenever the intensity or the height of the peak corresponds to the number of nucleotide. In this case, you can see G, there is only one G, so you are getting a height of 100. Whereas in this case, you can see there are 2 peaks, which is corresponding to 200, so indicating that there are 2 Gs. So likewise, the intensity of the peak is corresponding to the amount of nucleotide which has been incorporated. So if you see how does it plays an important role in pyrosequencing in BRAF mutation. So this is what we detect in case of BRAF mutation. So T to A, this is a reverse sequence, hence A is the wild type and T is the mutant type. This is a clear-cut negative result wherein T is approximately 0%. Whereas if you have a mutation in the patient for BRAF mutation, you can see there is a peak of T here, and this corresponds to 31%. Now, pyrosequencing is a kind of semi-quantitative because it gives you also the allelic burden in case of BRAF mutation. So these are two articles which we have published using pyrosequencing in thyroid tumors and in case of malignant melanomas. Moving ahead, in case of real-time based PCR, BRAF mutation can mostly used by allele-specific oligonucleotides, wherein we have two sets of probe. One probe which is corresponding to the wild type allele, and the mutant probe which is corresponding to the mutant probe. So if there is a wild type or negative result, then only you will see the wild type probe will bind to the target, and you will get only one signal, fluorescent signals, which could be either red or green. But in case of mutation, both wild type and mutant allele probe will bind, as a result of which there will be amplification of both the probe, and then you can see two different types of fluorescent, and that's how you interpret the result as positive. This is a typical example of a real-time based PCR amplification, wherein the presence of single peak wild type is seen in case of wild type result, wherein V600E is normal, whereas wherever there is a mutation of V600E, you will see two peaks because one of the probe is from wild type and the other probe is from V600E. Again, the advantage of BRAF mutation detection by real-time PCR is that it is very sensitive. But again, this limitation is that only known mutation can be detected. And another advantage is that it leads very less amount of tumor, which is as low as 3 to 5% the tumor. Moving ahead to the latest, which is being discussed offline quite a lot number of time, is NGS. Now, it is not recommended to screen only BRAF mutation on NGS because it will be overkill of a so hence a panel and a panel which is having both BRAF and other genes for specific to lung cancer is the most widely recommended panel. So these are the 9 gene panel, which is the bare minimum gene which should be included in a panel. And in case of RNA fusion, ALK, RET, ROS, and NTRK panels is recommended. And how does the analysis looks like? BRAF mutation analysis goes through different pipelines, and after the thorough quality check and everything, you get to know the quality of the reads. So these are the total reads. You can see out of this total reads, 510 reads, A is corresponding to the wild type and T correspond to the mutant. So roughly there is a variant allelic frequency of 59%, and that's how the result is interpreted in case of NGS. So in order to summarize, if you see, there is a comparison of these methodologies for BRAF mutations in terms of parameters. So in terms of mutation detection, IST can detect very specific mutation, either V600E or a clone which is specific to a particular mutation, whereas Sanger sequencing, pyrosequencing, and NGS can detect almost all the type of mutation, and real-time is again a mutation-specific technology. Limit of detection is for IST is 5%, whereas for Sanger sequencing it is 15 to 20%. That's why it is not recommended for especially for solid tumors. Pyrosequencing it is around 5%, and real-time PCR is 1%. Specificity wise, almost all the technologies are good enough, and they detect more than 90 to 95% of the specificity. But again, Sanger and NGS stands out with respect to other methodology. As far as the cost goes, definitely IST is low cost, whereas Sanger is medium cost, and pyrosequencing and the NGS is being relatively high as compared to other technology, and real-time is almost medium in terms of cost per test. And TAT-wise, again, IST is pretty faster. Sanger is around 1 to 2 days. Pyrosequencing is around 1 to 2 days. Real-time 1 day. NGS is a bit longer because you need to pull samples, and it has multiple steps before getting the result. And as far as the interpretation, which is the main discussion over here, is that IST, again, it is subjective. It varies from person to person, whereas Sanger is easy to analyze, whereas pyrosequencing it needs relatively less amount of skill as compared to NGS. NGS needs a various trained person who can do the bioinformatic analysis and then give the result. So in terms of analysis, interpretation, NGS is the most difficult one, whereas others are relatively less. So in short, just to summarize that choosing the right methodology depends upon what is the need, what is the workload or what is the affordability for the patient, and basis of this we can decide what methodology will be the best. Thank you for your time.
Thank you.